I'm Greg Grunberg, and I'm on the road to capture the stories of amazing families living with rare epilepsy. These are stories of love, perseverance, and hope. Today, my son is living well with epilepsy, but I know firsthand what it's like to be a caregiver to a child with a rare seizure disorder. These families have been through the unthinkable, and they're here to talk about it, laugh about it, hug about it. And I'm here to take care of them. This is The Caregiver. Thanks for hanging with us. Leslie and I spent the day recharging with some art therapy. If you haven't watched the previous episodes of The Caregiver leading to this point, go back and watch them. Trust me. Because our next and final stop of the day is a special dinner with Leslie's amazing family. Her husband, Mike, her daughter, Kelley, and Sharon, who helps Kelley in her day program and is basically a member of the family.
Hey!
Oh, I like what I'm seeing. What are we doing, Kelley?
What are you doing, Cal?
What are we
We're
doing?
making pizza.
Kelly,
Woo!
do you want to introduce your friend to Greg? What's her name?
Sharon.
This is Sharon.
Sharon Greg.
Hi, Sharon. How are you? Nice to meet
Greg
you.
help you?
Can I help you?
Show Greg how to use that rolling pin.
Oh,
Good.
look at that.
Good. Push hard.
Oh, yeah.
Go, girl.
That's great. Let me try it with mine right here. What's your favorite topping?
Pepperoni and cheese.
Oh, that's like me.
Do this, Sharon?
Yeah. You got it?
Yeah, just hold it, though.
Hey.
Nice.
All right.
It's really good.
Really?
Good pizza.
It's good.
Well, I took your mom, Leslie and I went on an adventure, and we made some art. And it was really fun. And we got to paint, and we got to draw. I'm going to show you two pieces of art, and I want you to tell me which one do you think your mom did, okay?
Yeah.
All right, here we go.
Hey.
These are really,
come on.
really cool. Do. What do you think?
Wow.
Is that a heart?
That is a heart. Look at this.
Who painted it though, Kelley?
Grandma.
Grandma
Yeah.
Not one of the options, Kelley.
Yeah, okay. All right.
Grandma's.
Do you like it?
Yeah.
And then what do you think of this one? This one might be my favorite.
Which one did Greg paint? The heart
Which one?
or the ocean?
Did Mom paint that or Greg paint that?
Greg paint that.
Oh, hey.
That's Mommy's.
Mom painted
Nice
this one.
try, Kelley. Nice try.
Yeah.
This has been unbelievable. Like, I feel like you really have touched my heart. Your family,
Oh.
so beautiful.
We loved having you, and Kelly loved you, and then that is you should really cherish that.
I have to say, I met somebody today that I instantly see why it must have been a much easier decision in times when you're traveling and you're not here. You and Mike are busy. Man, Sharon is
awesome.
wonderful. What a great caregiver
She's a gift. Sharon's whole family, her sisters, her parents, her aunties, and they've all been caregivers, and they are Kelly's family. They're her second family, and I'm so lucky.
What I've learned from you is just be as fearless of an advocate as you possibly can,
Right.
because no one knows your kid better than you.
Right.
So let's say somebody is watching this right now and they don't know what's going on. What advice do you give somebody who is about to start on this journey? They're thinking about trying EPIDIOLEX, let's say. What advice do you give them?
You can't let your fears inhibit what might be the right medication. And for Kelley, it was that medication that got all the seizures that I couldn't see.
Mm-hmm.
The sooner you can stop the seizures or reduce them significantly so there's fewer seizures, the better a life that child's going to have.
That's so true. You told me that the doctors warned you about some of the possible side effects, like increased liver enzymes and sleepiness. Was that ever an issue for you guys?
The most common ones are fatigue. She did take naps in the morning with that. I made the decision because the benefit of fewer seizures was far more important to Kelley than anything else. And she's a rock star. She's an all-star because she's done it since she was 4 weeks old. And her journey's not done. She has other things besides just the seizures she has to deal with medically. And she does it with a smile on her face and no fear. And that's what motivates me, because she is my hope. how she looks at things.
What did you get out of today? I mean, are you going to please tell me you're going to do a little bit more of this?
Well, so what I will tell you is you reminded me, like I'm going to remind you, that we need to stop and take care of ourselves. You just have to go, and you just have to live your life.
Thank you for sharing your story and your beautiful family, and for doodling with me today.
Well, thanks for letting me be part of your world, and my family loves you.
I got so much out of my day with Leslie, and I hope you did too. Leslie's journey reflects all of our stories, the struggles, the victories, and the hopes that come with a new day. It was such an honor to be welcomed into Leslie's home, meet her family, and it really goes to show we're not alone. Join me for my next mission. I meet another family who really show us all how to work together as a team.
Important safety information and indications. What is the most important information I should know about EPIDIOLEX, cannabidiol? Do not take if you are allergic to cannabidiol or any of the ingredients in EPIDIOLEX. EPIDIOLEX may cause liver problems. Your doctor may order blood tests to check your liver before and during EPIDIOLEX treatment. In some cases, EPIDIOLEX treatment may need to be stopped. Call your doctor right away if you start to have any of these signs and symptoms of liver problems during treatment with EPIDIOLEX. Loss of appetite, nausea, vomiting, fever, feeling unwell, unusual tiredness, yellowing of the skin or the whites of the eyes, jaundice, itching, unusual darkening of the urine, right upper stomach area pain or discomfort. EPIDIOLEX may cause you to feel sleepy, which may get better over time. Other medicines, for example clobazam, or alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how EPIDIOLEX affects you. Like other anti-seizure medicines, EPIDIOLEX may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your doctor right away if you have any signs of depression or anxiety, thoughts about suicide or self-harm, feelings of agitation or restlessness, aggression, irritability, or other unusual changes in behavior or mood, especially if they are new, worse, or worry you. Take EPIDIOLEX exactly as your doctor tells you. Do not stop taking EPIDIOLEX without first talking to your doctor. Stopping an anti-seizure medicine suddenly can cause serious problems. What else should I know when taking EPIDIOLEX? The most common side effects of EPIDIOLEX include increase in liver enzymes, sleepiness, decreased appetite, diarrhea, fever, vomiting, feeling very tired and weak, rash, sleep problems, and infections. EPIDIOLEX may affect the way other medicines work, and other medicines may affect how EPIDIOLEX works. Do not start or stop other medicines without talking to your doctor. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and cannabis-based products. What additional information applies to women? If you are pregnant or plan to become pregnant, EPIDIOLEX may harm your unborn baby, and medicines like EPIDIOLEX may be passed into breast milk. You and your doctor will decide if you should take EPIDIOLEX and about the best way to feed your baby while taking EPIDIOLEX. If you become pregnant while taking EPIDIOLEX, discuss registering with the EPIDIOLEX Pregnancy Surveillance Program, 855-272-7158, or EPIDIOLEXPregnancyStudy.com, and the North American Anti-Epileptic Drug Pregnancy Registry, 888-233-2334, or AEDPregnancyRegistry.org. The purpose of these registries is to collect information about the safety of anti-seizure medicines during pregnancy. What is EPIDIOLEX cannabidiol? EPIDIOLEX is a prescription medicine that is used to treat seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis complex in patients 1 year of age and older. It is not known if EPIDIOLEX is safe and effective in children under 1 year of age. Please read the EPIDIOLEX medication guide and instructions for use for additional important information. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Jazz Pharmaceuticals at 1-800-520-5568.